Morning, good afternoon, good evening everyone. Today we are going to discuss about another class of drugs, that is antiplatelet drugs in unit 2 cardiovascular pharmacology. So antiplatelet drugs, the drugs which are used to inhibit the platelet aggregations, we call antiplatelet drugs. But first we have to understand why particularly the blood which is flowing in the systemic circulation. For example, this is your blood vessels, right? So blood vessels are lined by your endothelial cells. This is your endothelium, right? This is your endothelium, and healthy endothelial cells release some chemical substances which are antiplatelet and anticoagulant in nature. So what are these substances? Because in the blood supply there is a movement of your platelets, and platelets are important for the coagulations or important for your platelet actions. So these platelets which are moving in the systemic circulations, why they are not attaching with the endotheliums? So that means your healthy endothelial cells are releasing some substances which prevent the attachment of platelet to the endothelial cells. So what are these substances which are released by healthy endothelial cells? So one of the substances which is released by the endothelial cell is nitric oxide. There is a substance which is released by endothelial cell is PGI2, that is a prostacyclin. PGI2, that we call prostacyclin. PGI2. There is a substance which is released by endothelial cells, healthy endothelial cells, that is your ADP dephosphatase. So these all are the chemicals which are released by endothelial cells and prevent the attachment of your platelets to the healthy endothelials, right? So these all substances are antiplatelet in nature. What are these substances? Nitric oxide, that is vasodilators, your prostacyclin, that is your PGI2, then there is a ADP dephosphatase. These are antiplatelet in nature, right? So particularly what happens when there is any injury, when there is a external injury or internal injury? So their endothelial cell is going to damage, right? So your endothelial cell is going to damage. For example, there is a damage is happened to this site. For example, there is any injury due to any externals or internal injury, these endothelial cell has been damaged. So when your endothelial cells are damaged, so do you think these substances like nitric oxide, prostacyclin or ADP dephosphatase will release? No, it will not release, because it's a damaged endothelial. Healthy endothelial cells are releasing these substances, nitric oxide, PGI2s and ADP dephosphatase. But when your endothelial cells are damaged by any injury, so what will happen? These damaged endothelial cells, this part will not release these substances, and when these substances are not released, so your platelets are not, your platelets is going to adhere, right? So damaged endothelial is going to release one more chemicals, damaged endothelium, right? We remember damaged endothelium is going to release von Willebrand factors, VWF, von Willebrand factors. And this von Willebrand factor is act as a sticky material for the platelets. So platelet is going to adhere to this damaged endothelium. Here platelets are going to be adhere. So first steps in the platelet aggregations, first step is platelet adhesions. So once your platelet is going to adhere on these surfaces and going to stick with the von Willebrand factors, so next step is platelet activation. So your platelet is going to activate. So second step is platelet activations. Platelets are going to activate, right? So your platelets are going to activate. That is your second step. During the platelet activations, lot of chemicals are going to release on the platelets, and these chemicals are the aggregator of the platelets. So after this, after platelet activations, what will happen? Lot of chemicals are going to release on the surfaces of the platelets. On these surfaces, lot of chemical will be released. I will discuss what are these chemicals and how these chemicals are formed. but at this stage you just understand that first step is platelet are going to adhere. Where these platelets are going to adhere? They are going to adhere with the damaged endothelium, and damaged endothelium is going to release one factor, that is the von Willebrand factor. So first step is platelet adherence. After that, when platelet adhere, it is going under the process of activations, and during the activation process platelets going to produce some chemicals, and these chemical will express on the surfaces of the platelet, and these chemical will attract more platelets on this side, right. So that is third step is your platelet aggregations. Platelet aggregations. So there are three steps, and this forms the primary plug, and your bleeding will stop, right. So the drugs, we are discussing about antiplatelet drugs. So drugs which are interfering with these mechanism, that is we called antiplatelet drugs, right. So one by one we are going to discuss, but first you have to understand, first thing is why blood which is flowing in the systemic circulation, why it doesn't clot even though your blood contains the platelets. The reason is because our healthy endothelial cell are releasing some substances like nitric oxide, like prostacyclin, PGI2, like ADP dephosphatase, which prevent the attachment of platelet to the endothelium. But when there is any injury, due to injury your endothelium is going to damage, and due to that damaged endothelium is not going to release these substances which inhibit the attachment of platelets to the endothelial cells. Meantime, this damaged endothelium also going to release one factor, that is the von Willebrand factor, and these platelets are going to attach with this material, that is the von Willebrand factor. And first step is platelet adhesions. Platelet is going to adhere, and once platelet is going to adhere, these are going to activate. So platelet activation is the second step, and during the activation step, what I told you, there is a lot of chemical substances are expressed on the surfaces of the platelets, and these substances is going to attract more platelets, and that is the platelet aggregation, and this form the primary plug, and your bleeding will be stopped, right. But what you have to understand, what are these chemicals and how these chemicals are produced, which increase the platelet aggregation. What are these chemicals? So you have to understand these steps, then we can understand about the drugs as well. So as I said, this is your endothelium, right. Now your endothelium is damaged. So there is a damaged endothelium. So in damaged endothelium there is a von Willebrand factor is released. Your platelet is going to adhere. So first step is adherence. This is the platelet adhesions. This is your first steps. So after adhesion, these platelets are going under the process of second step, that is the platelet activations. So what happens during the platelet activations? So one step is during the platelet activations, one enzyme is going to activate. That enzyme name is phospholipases A2. This enzyme is going to activate. What this phospholipase A2 will do? So this phospholipase A2 will do the degradations of phospholipids. Phospholipids, which is major component of cell membrane, which is a major component of your platelet cell membrane. So cell membrane component, cell membrane is made up of phospholipid, right. So what happens during the platelet activation steps, one enzyme which is going to activate, that is the phospholipase A2. What the phospholipase A2 do? Phospholipase A2 will do the degradation of phospholipid into arachidonic acids. Arachidonic acids, right. And this arachidonic acids, on this arachidonic acid two enzymes will work. One is COX, another one is LOX. COX we call cyclooxygenases and LOX we call lipooxygenases. So COX, when COX will act on the arachidonic acids, prostaglandin will form like PGG2, PGH2 and your PGI2, right. These chemicals are going to form. Along with PGI2s, there is a formations of TXA2 as well. LOX will do the formations of leukotrienes. COX will do the formation of prostaglandin, first PGG2, then PGH2, then PGI2 and TXA2, right. PGI2 is formed in your endothelial cells and TXA2 is in platelets. So we are discussing about the platelet. So in platelet, TXA2 will be formed, and TXA2 will be formed and expressed on the cell surface TXA2. And TXA2 is a chemical which is a strong aggregator of platelets, right? It will aggregate, it will attract more platelets to aggregate here. So TXA2 is a platelet aggregator. So how it form? During the activation step, how it form? Phospholipases A2 activate. Phospholipases A2 do the degradation of phospholipid into arachidonic acid. Arachidonic acid, COX and LOX act. COX will do the synthesis of prostaglandin, and one of the prostaglandin is your TXA2. It's a thromboxane, and thromboxane is the strong aggregator of the platelets. So more platelets is going to aggregate. This is a one of the mechanism by which platelets are activated and producing one chemical on the surfaces of the platelets. Another, during the activation steps, platelets are also going to express ADP receptors. ADP will be produced and it act on the receptors, that is P2Y12 receptors of the ATP. So this activation of these receptors will result in more aggregation of platelets. So ADP is a platelet aggregator. In last slides I have shown you ADP dephosphatase. ADP dephosphatase is a platelet inhibitors, but ADP is a platelet aggregators. How it do the aggregation of platelet? ADP has a receptors on the platelet P2Y12. These are the receptors on the platelets. So when it act on these receptors, it will do more aggregations of the platelets. So this is another mechanism by which platelet aggregations happen, right? Platelet activations. Then another one is inside the platelets. In normal case, there is a one glycoproteins, and during the activation, this glycoprotein will be expressed on the platelet surfaces, and that glycoprotein is GP2B/3A. This is the glycoproteins. So this is the glycoproteins, and this glycoprotein is expressed. Where it expressed? It expressed on the surfaces of the platelets. So this is another. When these glycoprotein is expressed on the surfaces of platelet, it will attract more platelets, and the purpose is to stop the bleeding. So you want more platelet to aggregate at this stage. So these all processes will aggregate the platelets. So third step is platelet aggregations. Platelet aggregations. Platelet aggregations, right? So now if you want to inhibit the platelet aggregations, you want antiplatelet drugs. So antiplatelet drugs can interfere with one of these mechanisms. So how these will interfere? So one of the well-known antiplatelet drug is aspirin, right? Aspirin is well-known antiplatelet drug. So what does aspirin do? Aspirin is You all might heard about aspirin. So aspirin inhibit this COX, cyclooxygenases. Aspirin will inhibit COX, and it's a irreversible blocker of the COX. Irreversible means एक बार जो block कर दिया वो permanently block हो गया. That is irreversible. So aspirin is a drug which is antiplatelet in nature, and mechanism of aspirin is it inhibits the COX enzyme irreversibly, right? So when you are inhibiting the COX, so what will happen? Your TXA2 will also decrease, your PGI2 is also decrease, right? So now when you inhibit the COX here, so what will happen? Your PGI2 level is also decreased, your TXA2 is also decreased. So TXA2 is platelet aggregator, right? But PGI2 is a platelet inhibitor. So PGI2 is a platelet inhibitor, TXA2 is a platelet aggregator. So दोनों का level क्या होगा? कम हो जाएगा when you are blocking here, because after these steps these two are formed, TXA2 as well as PGI2. PGI2 is antiplatelet in nature, TXA2 is a platelet aggregator. तो दोनों का level कम हो जाएगा if you are giving the aspirin and aspirin is blocking here. So both the level is going to decrease. One is platelet aggregator, another one is platelet inhibitors. So net effect should be 0. So there should be no effect of the aspirin as an antiplatelet, but effect is there. Why you are getting this effect? तो effect कहाँ कैसे आ रहा है? Again I am repeating, अगर आप एस्पिरिन दे रहे हो, एस्पिरिन दवाई क्या करेगी? कॉक्स एंजाइम को ब्लॉक करेगी irreversibly. एक बार ब्लॉक कर दिया, कॉक्स अगर ब्लॉक होगा तो दोनों प्रोस्टाग्लैंडिन TXA2 थ्रोम्बोक्सिन एंड PGI2 दोनों का लेवल कम हो जाएगा। TXA2 प्लेटलेट के एग्रीगेशन को बढ़ाता है, PGI2 प्लेटलेट के एग्रीगेशन को इनहिबिट करता है। तो एक इनहिबिट करता है, एक बढ़ाता है, तो दोनों का लेवल कम हो जाएगा क्योंकि आप यहाँ पे ब्लॉक कर रहे हो और इसके बाद ये दोनों बन रहे हैं, तो दोनों कम हो गए, दोनों कम हो गए तो नेट इफेक्ट शुड बी 0। तो हाउ एस्पिरिन इज एंटीप्लेटलेट? टू आंसर टू दिस क्वेश्चन इज बिकॉज it depends upon the locations. So this TXA2 is forming on the platelets, right? And platelet don't have a nucleus. So aspirin is a irreversible blocker. एक बार जो आपने ब्लॉक कर दिया वो completely ब्लॉक हो जाएगा, तो TXA2 और बनेगा नहीं, right? But PGI2 is formed in the endothelial cell and endothelial cells have a nucleus. तो अगर न्यूक्लियस है तो अंडर द प्रोसेस ऑफ ट्रांसक्रिप्शन ट्रांसलेशंस इट कैन प्रोड्यूस more again PGI2, right? Even though you are blocking it irreversibly, PGI2 will be formed, and PGI2 is antiplatelet in nature and TXA2 is platelet aggregator. तो प्लेटलेट एग्रीगेटर तो आपने जो ब्लॉक कर दिया तो एक बार वो ब्लॉक हो गया कंप्लीटली, वो दोबारा प्लेटलेट नहीं बना पाएगा, राइट? तो नेट इफेक्ट इज एंटी प्लेटलेट। तो नेट इफेक्ट इज एंटी प्लेटलेट। हाउ यू आर गेटिंग एंटी प्लेटलेट इफेक्ट? बाय decreasing the level of TXA2 and by increasing the level of PGI2. PGI2 तो दोबारा बन जाएगा क्योंकि वो एंडोथेलियल सेल्स में है और एंडोथेलियल सेल्स में न्यूक्लियस है। So ultimately you are getting the antiplatelet effect of the aspirin. So this is the concept with respect to aspirin. Aspirin is a antiplatelet drugs, right? Now another drugs which is comes under antiplatelet drug is you can see the mechanism of platelet aggregations, platelet activations. So during platelet activations you can see that there is a ADP and ADP acting on its receptor P2 by 1,2, right? And by that one there is a more aggregation of platelet happen. So scientists have discovered a new drugs which is blocking these receptors. You can block these receptors. So there are a drugs which are blocking these receptors like ticlopidine, clopidogrel, prasugrel. These are the drugs which are blocking P2 by 1,2. And what are these? These are the receptors for the ADP. And what is ADP? ADP is a molecule which is going to aggregate more platelets. So in antiplatelet agents you want to inhibit the aggregation. So you can give the blocker of P2 by 1,2. अगर P2 by 1,2 का ब्लॉकर दोगे ड्रग्स लाइक टिक्लोपिडिन, क्लोपिडोग्रल, प्रेसुग्रल, तो क्या होगा? आपका ADP तो है बट ADP इज अनेबल टू एक्ट ऑन इट्स रिसेप्टर। अगर वो रिसेप्टर पे एक्ट नहीं कर रहा है तो प्लेटलेट एग्रीगेशन नहीं होगी, तो यू विल गेट द एंटीप्लेटलेट इफेक्ट, राइट? सो दीज आर द ड्रग। टिक्लोपिडिन वी हैव टू यूज केयरफुली बिकॉज इट कुड रिजल्ट इन थ्रम्बोसाइटोपिनिया। तो आप T से याद कर सकते हो, इट कुड रिजल्ट इन थ्रम्बोसाइटोपिनिया, राइट? क्लोपिडोग्रल एंड प्रेसुग्रल वी कैन यूज, but with respect to clopidogrel is a prodrug. Clopidogrel is a prodrug. So C by P 2C19, this is the liver enzyme which is required for it to convert clopidogrel into its active form. So C by P 2C19 is there in the liver which is required for the activation of clopidogrel, and clopidogrel is a prodrug. So C by P 2C19 will convert it into the active form, and that active form of the drugs will inhibit C by P2 by 1,2 receptors for the ADP. But problem arise when if you are using proton pump inhibitors along with clopidogrel, then it could create a problems. How it will create the problems? If the patient is using PPI, proton pump inhibitors like prazole, rabiprazole, omeprazole, right? Pantoprazole. So these are the drugs. Proton pump inhibitors are the inhibitors of C by P2C19, right? So these proton pump inhibitor will inhibit these enzymes. If you are giving the clopidogrel to the patients, so do you think this clopidogrel will be converted into the active form? No, because the enzymes which is converting clopidogrel into the active form, it's already inhibited by your proton pump inhibitors. So it will not convert into the active form, right? So we have to avoid the use of PPI when you are using these drugs like clopidogrel, right? Because C by P2C19 is required for the activations of clopidogrel, right? Then there is a prasugrel. Prasugrel is a more quicker than clopidogrel, but it could result in cerebral hemorrhage as well. And all these ticlopidine, clopidogrel, prasugrel, these drugs are irreversible inhibitors of P2x12. Aspirin is also the irreversible inhibitor of COX. These all drugs, ticlopidine, clopidogrel, prasugrel, these all are irreversible inhibitors of P2x12, right? So what actually happens if suppose you want to do the surgery of the patients, आपको सर्जरी करनी है, सर्जरी करोगे, so if you the patient is using antiplatelet drugs, so it could result in the bleeding के chances हो सकते हैं. तो in that case what you have to do, you have to stop these medicines at least 1 week before. एक हफ्ते पहले आपको ये दवाइयाँ बंद करनी पड़ेंगी, अदरवाइज रिस्क रहेगा ब्लीडिंग का अगर आप कोई सर्जरी कर रहे हो पेशेंट्स की, बिकॉज दीज आर द इरिवर्सिबल ब्लॉकर. क्यों 1 वीक? क्यों? क्योंकि प्लेटलेट की लाइफ स्पैन क्या है? 1 वीक. तो 1 वीक लगेगा नया प्लेटलेट्स बनने में, राइट? सो 1 वीक आपको पहले दवाई बंद करनी पड़ेगी अगर आप किसी की सर्जरी कर रहे हो, अगर वो एंटीप्लेटलेट ये ड्रग्स यूज कर रहा है, बिकॉज दीज आर द इरिवर्सिबल ब्लॉकर. इरिवर्सिबल, एक बार ब्लॉक कर दिए तो फिर परमानेंटली ब्लॉक कर देंगे. So that's why later on what the scientists have done, they have discovered new molecules which are reversible blocker. So reversible blocker of P2x12 is Grelor, like ticagrelor, like ticagrelor, canaglelor. These are the medicines which are reversible blocker of P2x12, reversible blocker. तो आप याद रख सकते हो ग्रीलोर, यहाँ पे क्या है? ग्रिल, आगे ग्रिल के क्या जुड़ा? और इज योर रिवर्सिबल. सो टिकाग्रिलोर, कैनाग्रिलोर, दीज आर द ड्रग्स विच आर अगेन P2x12 inhibitors, but these are reversible inhibitors, right? So in that cases, if you want to do the surgery of patients, you can do it because these are the reversible inhibitors. These are not irreversible, right? Then another drugs under antiplatelet is from where you can block this glycoprotein. This glycoproteins you can block, and the drugs which is blocking this GP2-3A is abiciximab. Abiciximab is the well-known drug which is your GP2B/3A inhibitors. Because अगर GP2B/3A ग्लाइकोप्रोटीन अगर प्लेटलेट्स पे एक्सप्रेस ज़्यादा होगा देन इट विल डू लॉट ऑफ प्लेटलेट एग्रीगेशंस. ये ज़्यादा से ज़्यादा प्लेटलेट्स को एग्रीगेट करवाएगा. तो ज़्यादा एग्रीगेट करवाएगा तो आप क्या करो कि इसको ही ब्लॉक कर दो. ब्लॉक कर दोगे तो एंटीप्लेटलेट एक्शन यू विल गेट. सो ड्रग इज abiciximab, ABICIXIMAB. Abiciximab is the drug which inhibit the GP2B/3A. And another drugs under antiplatelet is there is a prothrombin. Prothrombin is converted into thrombin. So thrombin also has a receptor on the platelet, and receptor of the thrombin are PAR. These are the receptors for the thrombin, and thrombin helps in the coagulations. So in platelet aggregation as well, right? Of course, prothrombin is converted into thrombin. In the presence of thrombin, your fibrinogen is converted into fibrin. That is your coagulation pathways, right? But apart from this thrombin is also acting on receptors, and receptor is also present on the platelets. And the receptors of the thrombin which is present on the platelet is PAR1. PAR is proteases activated receptors. Proteases activated receptors 1. Activated receptors 1. So we have discovered say drugs which is going to block this, right? You can block these receptors, and drug is atopaxar. The drugs which end with the paxar. Vorpaxar is another drug. Vorpaxar. So these are the drugs which is blocking the PAR1 receptors. So these are all your antiplatelet drugs. Again, if I explain, so first you have to understand why blood in the systemic circulations doesn't clot. The reason is because our healthy endothelial cells are releasing some substances which prevents the attachment of platelet to endothelium. What are these substances? These substances are nitric oxide, these substances are prostacyclin like PGI2, these substances are your ADP dephosphatase. So these all three substances are antiplatelet in nature. If you have a healthy endothelial cells, so it will release these substances, and these substances will inhibit the attachment of platelet to your endothelium. But when there is an injury happen, endothelial cells are damaged. So damaged endothelial cells will not release these substances. So your platelets can adhere with the endothelium, and to adhere, damaged endothelium cells will also release one chemical. That chemical name is von Willebrand factor. So with von Willebrand factor, this platelet will adhere. So that's why first step is platelet adhesions. After platelet adhesions, your platelets is going to activate, and during the activations, they will release some substances on the surfaces of platelets, and these substances will attract more platelets, and that will result in platelet aggregations. So what are these chemicals which is released during the activation steps? One is, during the activations, your phospholipases enzymes are going to activate, particularly phospholipase A2, and phospholipase A2 will do the degradation of phospholipids. This one, phospholipases A2 is going to activate. It going to do the degradation of phospholipid into the arachidonic acids, and arachidonic acids will be converted into prostaglandin and leukotriene by the enzymes. One is COX and another one is LOX. LOX is going to do the formation of leukotrienes, and COX is going to do the formations of prostaglandins, and during this you will find that it will do the formation of two chemicals. One is PGI2 and another one is TXA2. So TXA2 chemical will be released and expressed on the surfaces of the platelet, and TXA2, that is thromboxane, is platelet aggregator. It will aggregate more platelets. So this is one of the chemicals which is released during the activation step, right? Another chemical which is released during the activation step is ADP. So ADP will be released. It acts on its receptor. Receptor are P2 by 1,2, and by acting of the ADP on its receptor will do lot of platelet aggregations. This is another molecule. There is a third molecules which is glycoproteins. Normally glycoproteins receptors are inside the platelets, but when there is a activation is happens, so during that steps, these glycoprotein receptors are going to express on the surfaces. These one are GP2B by 3A, and it's going to aggregate more platelets. So there are three substances, right? One is your TXA2, thromboxane, another one is your ADP, which is platelet aggregators, and another one is your GP2 2B by 3A glycoproteins, right? So now when we talk about antiplatelet drugs, so antiplatelet drugs are those drugs which inhibit the platelet aggregations, so you can interfere with any steps. So well known drug is aspirin. तो aspirin की हमने बात की, aspirin inhibiting the COX enzyme irreversibly. So when COX enzyme is inhibited, so there is a TXA2 level is going to decrease, as well as PGI2. PGI2, I told you, healthy endothelial cell release the PGI2, that is a prostacyclin, and it inhibits the platelet aggregations, whereas TXA2 is a platelet aggregators. So one is platelet aggregator, another one is platelet inhibitors, and if you are blocking the COX, so both level is going to decrease, दोनों का level कम हो जाएगा, aggregator का भी और inhibitor का भी. So net effect of the aspirin should be zero. It should not be antiplatelet. But how we are getting the antiplatelet effect? That means there is another story. The story is depending upon their locations. This TXA2 is forming on the platelets, and platelet don't have a nucleus, and aspirin is a irreversible blocker, so it will block it completely. So TXA2 will not form, right? Once it block, it will be blocked. But PGI2 is produced by your endothelial cells, and endothelial cells have a nucleus. So even though if you are blocking it, endothelial cells can produce your PGI2. So net effect, what will be the net effect? Net effect will be antiplatelet, right? Your TXA2 will be decreased, PGI2 will increase. So what will be the net effect? Net effect is antiplatelets. So that's why we are getting the antiplatelet effects of aspirin. Another mechanism, another way where you can block and produce the antiplatelet actions, you can have a blocker of P2 by 1,2. These are the receptor for ADP, and ADP is a platelet aggregator. So you can block it. तो आप block करने के लिए you have a drugs like ticlopidine, clopidogrel and prasugrel. Ticlopidine could result in thrombocytopenia, but clopidogrel and prasugrel are the safe drugs, right? So what are these drugs? These drugs are inhibiting what? Inhibiting the receptor of ADP. ADP क्या है? ADP is a platelet aggregator. So the receptor of ADP is P2 by 1,2. So these drugs are inhibiting these receptors. So even though ADP is there, but ADP is not acting, and if it's not acting, platelet aggregation will not happen. With respect to clopidogrel, clopidogrel is a prodrug. It need a one enzyme, that is a C by P2C19 in the livers to convert into its active form, right? But if you are using the drugs which are the C by P2C19 blockers, so your clopidogrel will not become active. Like if you are using clopidogrel with proton pump inhibitors, so most of the proton pump inhibitor will block C by P2C19, and if it's blocked and if you are giving the clopidogrel drug to the patients, so what will happen? Your clopidogrel will not convert into the active form because your enzyme is blocked by the proton pump inhibitors. So you have to avoid the use of proton pump inhibitors or C by any drugs which is blocking the C by P2C19 if you want to use the clopidogrel, because for the activation of clopidogrel you need C by P2C19 enzymes. That is one. Then I told you these all drugs are irreversible blocker of CP2 by 12. These are irreversible blocker. So I told you if you want to do the surgery of the patients, you have to stop these medicines at least 1 week before, then you can do the surgery, right? Otherwise there is a risk of bleeding because these are the antiplatelet drugs. सर्जरी में आपको काटनी पड़ेगी बॉडी, काटोगे तो उसमें चांसेस रहेगा कि ब्लीडिंग हो जाए, और क्योंकि आपने पेशेंट्स को एंटीप्लेटलेट दे रखी हैं, प्लेटलेट आपने उसका ब्लॉक कर रखा है, वो भी ब्लॉक कर रखा है इरिवर्सिबल, तो प्लेटलेट तो बनेगा ही नहीं, प्लेटलेट बनेगा नहीं तो रिस्क ऑफ ब्लीडिंग विल बी मोर. सो आपको एक हफ्ता पहले दवाई बंद करनी पड़ेगी. पर फॉर एग्जांपल किसी की सर्जरी आपको जल्दी करनी है तो आपके पास टाइम नहीं है एक हफ्ते का, तो उस केस में क्या करोगे? उस केस में यू हैव ए रिवर्सिबल ब्लॉकर ऑफ P2 by 12. तो रिवर्सिबल ब्लॉकर ऑफ P2 by 12 इज टिकाग्रिलोर, कैनाग्लिरोर, ग्रिलोर, ग्रिलोर, ग्रिलोर. इफ यू सी द वर्ड ग्रिल, आगे क्या लगा? OR. OR इज मीन्स रिवर्सिबल. So these are the reversible inhibitor of what? Reversible inhibitor of P2 by 12, right? अब और कहाँ पे आप ब्लॉक कर सकते हो एंटीप्लेटलेट? आप इसको ब्लॉक कर दो, Gp2 by 3A. So if you are blocking this, you can get the antiplatelet actions. The drugs for this one is abiciximab. Another ब्लॉक कहाँ कर सकते हो? प्रोथ्रोम्बिन. थ्रोम्बिन के जो रिसेप्टर्स हैं वो प्लेटलेट्स पे भी हैं, तो जो थ्रोम्बिन के रिसेप्टर प्लेटलेट पे हैं वो रिसेप्टर्स का नाम है PAR. PAR इज प्रोटीएज एक्टिवेटेड रिसेप्टर 1. तो प्रोटीएज एक्टिवेटेड रिसेप्टर 1 को ब्लॉक कर दो तो आपका थ्रोम्बिन जो है वो प्लेटलेट एग्रीगेशन नहीं करवाएगा. थ्रोम्बिन का दूसरा भी काम है, थ्रोम्बिन आपका फाइब्रिनोजन को फाइब्रिन में भी कन्वर्ट करता है कोगुलेशंस में, बट यहाँ पे वो प्लेटलेट की एग्रीगेशन में भी हेल्प करता है थ्रू एक्टिवेशन ऑफ दिस रिसेप्टर PAR1, प्रोटीएजेज एक्टिवेटेड रिसेप्टर 1. तो आप क्या करो, इस रिसेप्टर को भी ब्लॉक कर दो. द ड्रग विच आर ब्लॉकिंग दिस is atopaxar, the drugs which end with paxar, atopaxar, vorpaxar. So these are the drugs which are under antiplatelet drugs. So these are all are the drugs which are under antiplatelets, starting from aspirin, ticlopidine, clopidogrel, prasugrel, ticagrelor, canagrelor, abiciximab, and your atopaxar, vorpaxar. So this is all about your antiplatelet drugs. If quickly I can tell, antiplatelet drugs. So what are under the antiplatelet drugs? One is aspirin, is well known, and how aspirin is showing actions, it inhibiting the COX enzymes, right? Irreversible blockers. Then there is your P2 by 12 receptor blockers. And drugs are your, under this one there are two types of drugs, reversible blockers and irreversible blockers. So this P2 by 12 are the receptors of what? Receptors of ADP. These are the receptor of ADP, and ADP is a platelet aggregator. So under reversibles the drugs are clopidogrel, ticlopidine, prasugrel. These are the drugs. Under irreversibles there is a canagrelor, ticagrelor. These are the reversible blocker under this P/12 blockers. There are the third category of the drugs which are your these are GP2B/3A blockers, and drugs under this category is your abiciximab. Then there is a drug under next category is your drugs which is blocking the thrombin receptors, and thrombin receptors receptor is PAR1. So if you are blocking the PAR1 blocker drug is atopaxar, right, vorpaxar. These are the drugs, Paxar. So these are your antiplatelet drugs which are being used. Aspirin, clopidogrel, ticlopidine, prasugrel, canaglilor, ticagrelor, abiciximab, atopaxar, vorpaxar, right. So this is all about your antiplatelet drugs, right. So thank you so much.